Ons gesels vanoggend met Dr. Aisha Pandor oor die invloed wat die pandemie op huishulpe het. And Dr. Pandor, thank you so much for joining us this morning.
Thanks for having me.
And I would like to start, we'll get to the survey and the study a little bit later, but you are simply such a remarkable woman. So I would like to start with your background. Please just tell us or give us a little bit more background on yourself.
Thank you, sure. So my background is previously a scientist studying human genetics, but sort of shifted careers into working in the business space with the technology-based startup called SweepSelf. So I'm really focused on making a positive impact in South Africa, trying to positively impact employment in our country, economic growth. And with our business, SweepSelf, we use technology to help domestic workers around the country have access to work opportunities by connecting them with customers.
Like I've said, remarkable. And then just what does SweepSelf entail exactly?
So it's a really quick, easy, convenient way for customers who use our app to book a range of home services. So including cleaning, but also gardening services, pool cleaning services, electricians, plumbers, basically any home help that you might need. And we've used technology quite similar to the way that Uber has done for the sort of taxi industry of getting rides. We've used technology to make booking someone to come and help you super quick, easy. You should be able to complete a booking within 1 minute. So whereas you were phoning, friends or going onto social media to ask people for recommendations, now you can use our app to connect to someone who's been fully screened and vetted and rated literally within a minute or two.
What was the inspiration behind this initiative?
So I think like lots of business ideas out of personal need, when I was sort of transitioning into entrepreneurship, myself and my co-founder, who is also my husband and who's our CTO in the business, so has built the technology part. We were working through different business ideas, trying to think about, what resonates with us, what presents a big opportunity, but also what is going to potentially have a big positive impact on the country. And at the time, our nanny at home said that she was going to be going away on holiday. She asked us to find a replacement for her. And in the process of trying to, again, this long thing, asking people for referrals, going on social media, interviewing agencies, we just realized how inconvenient it can be to get someone trusted to come and help you at home. And at the same time, recognize that there's still this huge problem of unemployment or underemployment amongst nannies and domestic workers. And so, the idea fell in our lap. We, through our own experience, said, wouldn't it be great to build something that can help solve this problem?
And it's very successful thus far.
We've been fortunate so far. So it's been about 7 years since launching. We are operating in South Africa in Cape Town, Johannesburg, Durban, Pretoria, and then a couple of smaller cities. We've also launched in Kenya, set to launch in Nigeria in the next 2 months. I've helped 25,000 women over the last few years find work opportunities. So I'm very proud of what we've done and particularly, the team. We've got a wonderful team behind us.
And it's such an inspirational story. Now, you've recently conducted a report and it's been conducted across 3 countries, South Africa, Kenya and Nigeria. So just give us a little bit more background regarding this specific report.
Sure. So we conduct an annual report on working and pay conditions for domestic workers. And we've previously kept it to South Africa. And every year we've grown the number of respondents who we work with as part of the survey. And we look at things like earnings, employment levels, living conditions, living costs. And this is the first year that we've done it in Kenya and Nigeria, in addition to South Africa. We've polled about 7,000 respondents. And in addition to our usual survey, because of the pandemic, we've also looked at the impacts of the pandemic and lockdowns on unemployment and earning levels.
Mm-hmm. And what are some of the most interesting and I guess also shocking findings that you can share with us?
Yeah, I think as expected, the pandemic has had quite a drastic effect on income and on earning levels. So what we've seen is that there was a big drop in average earnings from 2019 to 2020. There's been some recovery in 2021, but not yet back to 2019 levels. We've also seen that there's a difference in the response in different countries. And I think this points to the legislation in South Africa in particular, which caters to domestic workers. And also, I just think earning levels within South Africa, sort of average earning levels of employers of domestic workers compared to other countries. So definitely seen that in South Africa, domestic workers are faring better than in other countries. Other interesting and surprising findings were a level of potential hesitancy around vaccines, which we know to be the case, but the survey confirmed that there is a bit of stigma still and myth around vaccines, and that has to be combated so that we can have sort of widespread vaccine rollout. And then I think another finding that was interesting but not unexpected was the negative mental health aspect. So over a year going through a pandemic, negative impacts on earnings, negative impacts on employment levels. Obviously, there's going to be a mental health element to all of that. And part of our recommendation has been that we really start to look at how we support people from a mental health point of view.
And we'll get to those different findings because I would like us to, stand still and elaborate a little bit more. But something that was really, or that I find very shocking is in Kenya and Nigeria, about 2 in 5 domestic workers lost their jobs due to the pandemic versus 1 in 5 in South Africa.
Yeah, so again, I think it just speaks to things like the support that the South African government provided over the last year that have probably helped to soften the blow for a lot of employers. But yeah, very severe. And we know that in this industry, levels of unemployment tend to generally be higher than general levels of unemployment in the rest of the economy. So I think there are probably going to be lasting impacts on unemployment for domestic workers, and particularly, as you say, in Kenya and Nigeria.
I would also like to ask you, you've referred to the fact that you've done this research and that 7,000 or more than 7,000 respondents took part. But how difficult or easy was it to conduct this report?
So I think there definitely have been some lessons over the years, and we get better at collecting data as we go along and sort of find out what works and what doesn't work. So as an example, the rollout of the survey to collect data has been data free this year. So not having data then, for example, wouldn't be a factor for people not being able to answer it. But, again, we do have a big base of domestic workers who work through the platform. 25,000 who've worked with us. We have almost 200,000 who've applied for the platform. So, we've got a very, very big base to work with.
And when looking at unemployment or, the domestic workers, losing their jobs, what do you think is the solution in future?
I think more rollout of support in the short term will help. So, we've had the government-sponsored program last year to support people through lockdown levels. I think that level of support is necessary in future. But I think, longer term, what's really going to help is economic growth. I think what we need to remember is that domestic workers around the world are workers who work for private households. And so their income comes as a portion of the earnings of a private household. And so if you have amongst private homes, people who are being retrenched, people who are not having their own salaries able to be increased over time, that's going to have a negative impact on domestic workers. So it really comes with, better economic growth. And then, as I was saying, and fortunately in South Africa, we do have this, but legislation which protects the rights of domestic workers has always also been a positive. So things like minimum wage within this industry, legislation around treatment, and benefits that will also help in the longer term.
Well, I'm looking forward to the rest of the discussion. So bly gerus ingeskakel vir die res van hierdie gesprek. Ons gaan nou voort met vanoggend se gesprek en dit met Dr. Aisha Pandor en dit oor die invloed wat die pandemie op huishulpe het na aanleiding van navorsing wat hulle onlangs gedoen het. So Dr. Pandor, thanks again for joining us this morning. And I would really like us to get to the average earning of domestic workers versus their monthly living costs. Such a tragic finding.
Yeah, that's right. Also, so, we look at the earnings of domestic workers across the country as part of our survey. And as we were saying before the break, unfortunately, what we've seen is that earnings have dropped from 2019, dropped, quite a lot in 2020, and then have recovered slightly, but not back to 2019 levels. And the actual earnings themselves are incredibly low. So, on average, domestic workers earning less than 3,000 Rand a month. And again, I think this speaks to the fact that many domestic workers are earning incomes out of a family income. And when you consider that the average household income in South Africa is around 11,000 Rand, I think, it's sad findings, but unfortunately not surprising.
And then another interesting statistic, more than half, which is 67% of respondents owe money to a shop or store, which shows the high level of easy credit and also lending practices in South Africa.
That's right. And I think, when earnings go down and you have dependents to feed, unfortunately, in the absence of other support, that's where, people are needing to find debt, either from formal sources like, a shop, or unfortunately from, more predatory lenders who may have very, very high interest rates. So again, I think, the levels of debt just speak to the inability to fully cover household costs. And what we found quite worrying in the survey was the level of respondents who said that they really feel hopeless. So up to 40% in some instances feel really hopeless about the ability to repay that debt.
How do you feel about the findings regarding private medical aids or medical insurance?
So I think we're not that surprised, finding that only around 2% of domestic workers have private medical aid. I think given that South Africa has a very wide public healthcare system, and that there are other costs that are probably prioritized above healthcare, considering that, we're not surprised. But I think, when you look at healthcare needs, when you look at the fact that many of these women have dependents, multiple dependents, it does become an interesting question about whether we should have some form of sort of lower cost private healthcare that's made available to domestic workers.
I would also like, you've referred to it a little bit earlier, the physical and mental health issues. My question is, do you think that South Africa has the capacity to fight this challenge in future?
So I'm an optimist, Elsa, and I always say, I think yes, if we really highlight the issue of mental health, and I think this is not just with domestic workers. I think there's so many people, just kind of sensing the mood after the president's last announcement over the weekend. I think there are many people who are really struggling at the moment, and 15 months living through a pandemic is a long time. So I think it's not just domestic workers. I think mental health is a conversation that we need to be having out in the open across our communities and societies. And I think we can tackle this if we don't just rely on, for example, public health care needing to be provided. I think there's the opportunity for community-based leaders to be speaking about mental health, providing support to people. I think families need to talk about it and provide support to each other. I think friends can provide support to each other. So I think if we make it something that's more widely recognized, we could definitely do something about it.
Especially in terms of depression and anxiety. Do you agree?
Absolutely. So, many of the respondents in the survey, again, coming back and saying that those who had been diagnosed with mental health issues, depression ranked number one, anxiety number two. And yeah, these are things that are common, that fortunately are being spoken about more widely. And, and we know that if you reach out and try to get help, it's not the end of the world. These are things that are manageable.
And then let's get to awareness. What would you like to achieve with this specific report, and also by communicating it or, spreading the awareness regarding a lot of these findings?
I think the first thing is really just to make people more conscious about the living and working and earning conditions of domestic workers. So it's important for us to be able to be on platforms like this. So thank you again for having me to talk about the study. And then I think trying to just help employers to find ways that they can make a difference. So things like, for example, looking at how you treat the domestic worker who works in your home and looks after your family. Is there a way that you can help with sponsoring food? Are there ways that you speak to her, ask her if there are ways that you can make her life easier? Speak to friends and family also about what they pay domestic workers and if they're able to pay more and what that covers, because all that information is available in the survey. And then I think we also make wider recommendations so we make recommendations to governments around legislation, and we try to be a partner in trying to help or improve legislation. We, in this particular study, have spoken about, the vaccine hesitancy, which I mentioned earlier. So, can we help with community-based organizations to roll out wider education around vaccines? Because ultimately, that's going to be the only thing that's going to help stop the pandemic.
Dr. Pandor, huge respect. Thank you so much for joining us this morning.
Thanks for having me.
En ek het dit nou nie genoem nie, maar sy is dan nou ook die dokter van die baie geliefde minister Naledi Pandor. So dis sommer net so vir interessantheid wat ek dit ook wou ingooi.